This isn't a hospital, not really. It's a holding pen, a purgatory of harsh fluorescent lights and cheap plastic chairs where the desperate and the forgotten queue for a moment of attention. And it's the forgotten, the elderly, who break my heart every single shift. Every single time I push through these swinging doors, I feel a growing knot of outrage in my stomach because I see it plain as day, the systemic neglect, the utter lack of respect. It's not just a medical problem we're facing here in A&E. It's a moral one, a societal sickness. Take Margaret Taylor, 86 years old, sharp as a tack usually, but confused and frail tonight after a fall. She's been sitting on that hard chair for 7 hours, shivering under a flimsy blanket, forgotten in the clamor. 7 hours. And what does she need? Not just stitches, not just pain relief. She needs dignity. She needs a warm bed, a kind voice, reassurance that she matters. Instead, she gets the dismissive glance of staff rushing past, the ambient noise of alarms, and the knowledge that she's just another bed blocker, another number in a queue deemed less urgent than the latest sports injury. I saw her struggling to get to the lavatory earlier, her face a mask of mortification as she tried to navigate the crowded corridor with her unsteady gait. No one helped. No one even seemed to notice until I practically bodily lifted her myself. This isn't care. It's abandonment. I try. God knows I try. I fetch extra blankets. I offer a cup of tea. I sit for a minute, just a minute, to listen to their stories, the stories of lives lived, full of joy and sorrow, now reduced to a grim weight. But what good is my empathy when the system itself is so utterly devoid of it? When Dr. Miller, bless his tired heart, can barely look up from his notes to say, it's just a common cold, Eleonora, they're old. We've got the young lads from the football match waiting, fractured tibias, much more urgent cases. They're old, as if that's a diagnosis in itself, a valid reason to diminish their suffering, to trivialize their very existence. The implication is clear. Their lives are less valuable, their discomfort less significant. It's crushing to hear, soul-destroying to witness. It's not about the budget cuts alone, though they certainly don't help. It's deeper than that. It's a societal malaise, a subtle, insidious belief that once you've contributed, once you're past a certain age, you become a burden. The NHS, which should be the bedrock of our compassionate society, is becoming a reflection of this callous indifference. We tell ourselves we care for our elderly, yet we park them in corridors, leave them in soiled clothing because we're short-staffed, talk over their heads as if they're invisible. I've seen patients like Margaret waiting so long they've become incontinent in their seats, too afraid or too weak to ask for help, too humiliated to draw attention to their plight. The indignity etched on their faces haunts my dreams. This isn't just a waiting room. It's a crucible where our humanity is tested and too often found wanting. We're losing sight of what it means to care, to truly respect human life at every stage. We speak of dignity in death, but what about dignity in life, especially when life is at its most vulnerable? My heart aches for Margaret and for all the Margarets I see every night whose final years are tainted by the cold indifference of a system that has forgotten how to be human. This isn't just about bed availability or staff shortages. It's about remembering that the elderly aren't just cases. They are people, our elders, and they deserve so much more than this brutal, dehumanizing neglect. We must do better. We simply must. The air here, thick with the metallic tang of disinfectant and the underlying sin of fear, presses in on you. Another shift in A&E, another endless night of watching the system grind down the most vulnerable amongst us. Just look around. Trolley after trolley, a sea of bewildered faces, and somewhere in that sea, dignity slowly drowns. My name is Eleonora, and I am watching it happen every single day. The raw, gut-wrenching truth is that for many of our elderly patients, this is not a place of healing. It's a holding pen, a place where their last vestiges of self-respect are stripped away by sheer, brutal indifference. Margaret Taylor is just one example. 87 years old, admitted with a suspected UTI. But that's not her real diagnosis. Her real diagnosis is neglect. She's been here for 12 hours, shunted from one corridor to another, her small frame curled on a hard trolley, a thin blanket her only comfort against the sterile chill. I saw her earlier, her eyes wide and pleading, trying to catch someone's attention. Nurse, she whispered, her voice barely a rustle, I need the loop, please. I really need to go. I promised I'd be back, but the red lights were flashing, another critical patient, another urgent case pulling me away. When I finally returned, 20 minutes later, she was staring straight ahead, tears streaming silently down her wrinkled cheeks. Her small incontinence pad, meant for minor leaks, was soaked, and the thin hospital gown was damp. She tried so hard to wait. The shame on her face was a physical blow to me, a testament to our failure. And what was the response? Dr. Miller, bustling past, barely glanced over. "Oh, bless her," he mumbled, not slowing his pace. "It's just a common occurrence with the elderly, Eleonora. Get healthcare assistant to sort it. We've got more urgent cases waiting, haven't we? This isn't a 5-star hotel." Common occurrence? Is humiliation a common occurrence we simply shrug off now? This isn't about a medical diagnosis. It's about basic human dignity, the right to not be left to soil oneself in a crowded public corridor simply because you're old and slow and no longer deemed efficient enough for our overwhelmed system. The outrage burns within me, a constant fire. It's a systemic rot, isn't it? This notion that the elderly are somehow less deserving, less worthy of our immediate attention, our compassion. They become bed blockers or social admissions, their rich lives reduced to a set of symptoms and an inconvenient lack of home care. I hear it every day, the casual dismissals. "They're old. What do you expect?" I expect humanity. I expect respect for those who built this very society, who contributed a lifetime, only to find themselves abandoned to its cold, hard pragmatism in their twilight years. We treat them like expired products, not human beings with stories, memories, and an inherent right to comfort and privacy. The contrast here is stark. The frantic energy of the A&E, the beeping machines, the shouts for urgent help, and then the quiet despair of someone like Margaret, whose needs are just as profound but less dramatic, less critical in the medical sense, and therefore so easily ignored. This isn't just about underfunding, though that plays its part. It's about a deeper societal malaise, a cultural sickness that has taught us to view the elderly as a burden, as something to be managed and tolerated rather than cherished and respected. I feel utterly helpless sometimes, standing amidst the chaos, trying to mend the physical wounds while the emotional ones fester, invisible to the very system that inflicts them. When will we truly see them? When will their pleas stop falling on deaf ears? We are failing them utterly and profoundly, and in doing so, we are failing ourselves. We are losing our very humanity, one ignored cry at a time. The fluorescent glare of an E does something to the soul, I swear. It strips away compassion, leaving everything stark, clinical, and frankly brutal. Another night, another corridor full of patients, and another elderly soul fading into the background, unseen. Tonight, it's Margaret Taylor, 84 years young or old, depending on who you ask around here. She arrived with a suspected urinary tract infection, but what she's suffering from now is far more insidious, the slow, public death of dignity. I found her hours ago now, tucked away on a trolley in a bay that offers all the privacy of a bus stop. She'd been there since 7 this morning. It's past midnight now. Her small, frail hand was gripping the flimsy hospital sheet, her eyes watery and wide, fixed on me as I approached. She hadn't pressed her call bell. She just waited silently as if afraid to bother anyone. Afraid? In her own time of need. That kills me. Absolutely kills me. I pulled the curtain around her, such as it is, and she visibly sagged with relief. I think I've had an accident," she whispered, her voice barely audible. The shame in her eyes was a physical blow. She'd been lying in her own soiled clothes for hours, too proud, too intimidated to ask for help. Dr. Miller had brushed past earlier, not even making eye contact, merely remarking to another junior doctor, "Just another elderly UTI. They tend to fester a bit, don't they? Nothing urgent. Nothing urgent." Is her humiliation not urgent? Her absolute despair? My blood just boiled. It still is. This isn't about a diagnosis. This is about a human being, a life lived, reduced to a forgotten statistic in a bed in a corridor. It's about a system that has forgotten its humanity. I cleaned her gently, and she just sobbed, soft, heartbroken sounds that cut through the cacophony of the ward more effectively than any screaming. She wasn't crying from physical pain, but from the profound indignity of it all. This isn't a one-off. It's a daily spectacle here. Old Mister, Henderson, with his dementia, restrained because there wasn't enough staff to properly monitor him. Mrs. Davies, left to shout for water for so long her throat was raw because she was deemed low priority. We're meant to be a caring profession, a national health service, yet we've allowed ourselves to become a processing plant where the aged, the vulnerable are shunted to the sidings. My colleagues, some of them, they've become numb. What can you do, Eleonora? We're understaffed, underfunded. The bed crisis, the waiting lists, I hear it every shift. But that's not an excuse for ignoring a basic human right to respect and dignity. That's a symptom of a deeper societal sickness. This idea that the elderly are a burden, a drain on resources, an inconvenient fact of life that we'd rather just tuck away and forget. We talk about their frailty as if it's a personal failing, not a natural part of the human condition that demands more care, more attention, more empathy, not less. I often stand here amidst the organized chaos and feel utterly helpless, enraged. I can patch wounds, administer medication, but how do I heal a broken spirit? How do I mend a society that looks away, that allows its most vulnerable members to be treated with such casual cruelty? It isn't just the hospital, it's us. All of us. We've built a system that dehumanizes, that prioritizes youth and economic productivity over the wisdom and quiet grace of age. Margaret Taylor isn't just a patient with a UTI. She's a mirror reflecting our collective failure. And the reflection is ugly. It's truly, profoundly ugly. We are failing them every single day. I have to stop for a moment. What I see in this A&E goes beyond simple medicine. It's a human failure. I ask you, what would you do if this were your grandparent? Ignored, humiliated. We cannot stay silent. Silence is complicity. Get involved. Share this story. Educate yourselves on the rights of the elderly and raise your voice against the system. Now, back to Margaret Taylor. This ward, this A&E, it hums with a sterile, unforgiving rhythm, a constant low thrum of beeps and hurried footsteps. But beneath that cacophony, there's another sound, an unspoken one, the quiet despair of the forgotten. I see it every single shift, every single face. And frankly, I'm beyond outraged. My gut clenches with a cold fury that grows with each passing hour I spend battling not just illness, but indifference. Take Margaret Taylor. 86 years old, admitted with a suspected chest infection, but that's not her real diagnosis, is it? Her real diagnosis is elderly, and in this system, that often seems to be a pre-existing condition for neglect. I found her this morning, slumped in a chair by the bay window, a small, frail figure wrapped in a thin hospital gown. She'd soiled herself, not just a little, but thoroughly, and she was crying, a silent, almost imperceptible tremor, trying to gather the gown around her with trembling hands. She'd been sitting there for nearly an hour, she told me, too ashamed to ring the bell again after the last time. The last time she'd been told by a weary healthcare assistant, "We'll get to you, love, when we can." Plenty more urgent cases. Urgent? Is human dignity not urgent? To be left in your own filth, to be reduced to tears of shame in a public corridor, to feel so utterly dehumanized that you stop asking for basic care, that's a betrayal of everything we, the NHS, are supposed to stand for. I took her straight into a private bay, helped her clean up, got her fresh linen. All the while, she kept apologizing for needing help, for having an accident, for simply existing. It rips me apart. I've had colleagues like Dr. Miller tell me, "Eleonora, we're stretched." She's 86. What do you expect? These things happen, or it's just a common cold. They're old. Their immune systems are shot. We have a trauma coming in. It's dismissive. It's damning. It's a convenient narrative that allows them to compartmentalize and deprioritize a significant portion of our population. It's not just about her physical ailments. It's about the soul-crushing humiliation that chips away at their spirit until there's nothing left but resignation. I look at Margaret and I don't see a bed blocker or a drain on resources. I see a woman who has lived a full life, contributed to society, raised a family, paid her taxes, and now, in her most vulnerable state, she's treated as an inconvenience. It's not just here, in this specific A&E in Leeds, is it? It's a cultural sickness. A societal prejudice that sees the elderly as past it, as burdens, rather than as repositories of wisdom and history, people still deserving of fundamental respect. We champion youth, vitality, productivity, and once those attributes fade, so too, it seems, does our collective empathy. The sterile, Fluorescent lights of any only serve to highlight this brutal truth, contrasting starkly with the vulnerability etched on the faces of these patients. The noise of trolleys rattling past, the distant shouts, the constant movement, it all contributes to a sense of being lost, unheard, invisible. The tension here isn't just medical. It's deeply, fundamentally social and emotional. I feel this crushing helplessness sometimes, a profound despair at the enormity of the problem. I can clean Margaret Taylor. I can offer her a warm drink. I can hold her hand and tell her she matters. But what can I do against the systemic rot that allows this to happen again and again? We are failing them utterly, not just medically, but morally. This isn't about diagnosis. This is about dignity. It's about remembering that the old man moaning softly in the corner was once a strapping young lad full of dreams, just like us. When did we become so callous? When did compassion become a luxury we can no longer afford in our health system? We need to look ourselves in the mirror as a society and ask if this is truly the legacy we want to leave. Another shift, another wave of faces, another battle. But it's the quiet ones, the ones whose eyes tell stories of fading resilience that truly break you. They're here in this chaotic theater of beeping machines and strained voices because there's nowhere else. And what do we offer them? Too often, it's a form of purgatory. I see it every day, this insidious erosion of dignity. It's the way we speak to them, if we speak to them at all. The way they're left, sometimes for hours, in a corridor on a trolley, a flimsy curtain, their only shield from the relentless glare of the overhead lights and the gawking public. Margaret Taylor, 83 years young, if you can call it young, when your spirit is being crushed by the system that's meant to protect you. She arrived yesterday afternoon, a suspected UTI, weak and disoriented. We're 24 hours in, and she's still here, still waiting. She soiled herself this morning, lying there, half dozing, too proud or too frail to call out repeatedly. I found her face a mask of shame and despair. Just imagine. 83 years of living, of contributions, of raising a family, reduced to lying in her own waste on display in a public corridor. It's not just a medical oversight. It's an act of profound dehumanization. Dr. Miller, bustling past, barely glanced over. Just a bit of incontinence, Eleonora. We've got a trauma coming in, really pressing cases, as if Margaret's comfort, her fundamental human dignity, isn't pressing. As if her age automatically demotes her from deserving basic respect. It's infuriating. It's an outrage. I cleaned her, changed her, not because it's my designated task as an A&E specialist, but because someone had to. Because the alternative was to leave her there, to let that shame fester, to confirm her unspoken fear that she's become invisible. And as I did, I saw the tears in her eyes, not of pain, but of pure, crushing humiliation. It wasn't a medical issue I was addressing. It was a wound to her soul. This isn't an isolated incident. I remember old Mr. Davies left without his hearing aid for a full day, nodding vaguely, smiling politely, completely lost in a world of muffled sounds and misinterpreted words. Or Mrs. Henderson begging for a glass of water, ignored by exhausted juniors rushing to tick boxes until her lips were cracked and dry. They become background noise, easily dismissed, their complaints minimized as the ramblings of the old or simply not urgent enough. It's a system that's forgotten its heart. We call it the National Health Service, a beacon of compassion, but here, in the trenches of A&E, it often feels like a production line. The elderly, deemed less productive, less fixable in the grand scheme, are shunted aside. They're seen as a burden, a drain on resources that could be better spent elsewhere. That's the unspoken truth, the insidious prejudice that permeates these walls and, I fear, society itself. We've cultivated a culture of neglect where the very people who built this nation are treated as disposable once they've served their perceived purpose. I came into nursing to care, to advocate. But here, I often feel like I'm screaming into the void, fighting a tide of institutional indifference. The sterile coldness of this department contrasts sharply with the raw vulnerability of these patients, their quiet despair, a constant echo in my mind. We need to ask ourselves, truly ask ourselves, what kind of society we are becoming when we allow our elders to be treated with such casual cruelty. This isn't just about bed shortages or funding cuts. It's about a fundamental failure of humanity. It's about remembering that every patient, regardless of age, deserves dignity, respect, and a voice. especially the ones who struggle to find theirs. The fluorescent glare of a NE is relentless tonight, just as it is every night. It slices through the weary faces, starkly illuminating the sheer, unbearable truth of what we've become. I've been a nurse for 15 years, seen things that would break most people, but nothing prepares you for the indignity I witness daily, the systematic erasure of our elderly. I am Eleonora, and my heart aches, my soul burns for the forgotten, for those discarded as if their lives no longer hold value. Just this morning, Margaret Taylor arrived. 83 years old, frail, confused, clutching a threadbare cardigan like a shield against the world. She'd been brought in after a fall at home, left for hours on her cold kitchen floor because her care package, a laughable 15-minute visits a day, was utterly inadequate. When she finally got here, after another excruciating wait in the ambulance bay, what did we offer her? A trolley in the busiest corridor, directly opposite the triage desk, where every single person who walked past could gawp at her vulnerability. She lay there, shivering, a thin blanket offering little comfort against the glacial chill of the corridor, her quiet pleas for a drink lost in the cacophony. I saw her eyes, wide with fear and shame, struggling to maintain a sliver of privacy in a place that offered none. Her dignity, a lifetime's accumulation, was being stripped away, minute by agonizing minute, by the very system designed to care for her. And when I approached Dr. Miller, gently suggesting we find her a quieter corner, somewhere, anywhere, away from the public eye, he simply shrugged. Eleonora, we're swamped. She's stable. We have a gunshot wound coming in. These are the priorities. As if Margaret's terror, her profound humiliation, wasn't a gaping wound itself. As if her age automatically relegated her to the bottom of some invisible hierarchy of human suffering. It's a pattern I see relentlessly. Elderly patients, often confused, sometimes incontinent, left for hours, sometimes an entire shift without proper assistance. Their calls for help are met with sighs, their confusion with impatience. Just a bit of dementia, nothing we can do. I've heard countless times. They're old. What do you expect? This isn't just understaffing. This is a deeply ingrained callousness, a societal indifference that has permeated the very walls of our health service. We talk about bed blockers, about resource allocation, but we rarely, truly rarely, talk about the immense psychological toll this neglect takes on these individuals. I remember another lady, Mrs. Davies, left naked from the waist down for an hour in a cubicle because we were too busy to find her a clean gown immediately after a procedure. Her tears, silent and endless, haunt me. Or Mr. Henderson, who developed a severe pressure ulcer because he couldn't shift his weight and no one had the time to turn him regularly in the overcrowded bay. These aren't just medical failures. They are moral abominations. My outrage simmers constantly. I am here to advocate for them, to fight for their right to be treated as human beings, not just another ticking box on an overwhelmed system's to-do list. But there are only so many hours in a shift and only one of me. I push, I argue, I try to shield them, but the sheer tide of indifference is overwhelming. It's a lonely fight, often feeling utterly helpless. How can we, as a nation, allow this? How can we sit back and let our elderly, who built this very society, be treated as disposable, as an inconvenience? The sterile coldness of this department clashes violently with the burning shame in my gut, the desperate vulnerability of those who deserve so much more. This isn't just about their health. It's about our humanity. It's about a systemic failure that casts a dark shadow over our supposedly compassionate society. We are witnessing and often perpetuating Britain's shameful secret, hidden in plain sight behind these emergency doors.